Hello friends and welcome back to my YouTube channel. After the surgery, the road to recovery begins. Post-operative nursing care plays a crucial role in ensuring a patient's comfort, safety and healing. From pain management to monitoring for complication, nurses are the backbone of the recovery process. So in this video, we will explore the essential aspects of post-operative nursing care. So we will see first what is the post-operative phase. So post-operative phase begins with the admission of the client to the post-anesthetic care unit and ends when the healing is complete. So what are the nursing assessments that can be done in the post-operative or post-anesthetic care unit? So the nursing assessment in post-anesthetic care unit follows a structured approach, beginning with the ABC: airway, breathing, and circulation. So, ensuring a patent airway, monitoring oxygen levels, and assessing heart rate, blood pressure are the top priority in the immediately post operative period. Then, level of consciousness. So, neurological assessment is equally important. Nurses evaluate the patient's level of consciousness, response to any stimuli, and orientation as they wake from the anesthesia. So, changes in the mental status could indicate complications that require immediate attention. Then, the urinary output. So, in PSU, nurses should assess the urinary output to ensure adequate perfusion, kidney functions. That is the typically guideline is at least zero point 0.5 ml per kg per hour should be there. Decreased urine output may indicate hypovolemia, decreased cardiac output, and potential kidney dysfunction. Then the pain management and wound assessment. So, monitoring for signs of postoperative complications such as bleeding, respiratory distress. Then you have to see the condition of the surgical wound. Is there any presence of IV lines? So, it should be hanged properly. There should not be any leakage, and position of the patient. So patient should be comfortably put in a position, should not give any pillow after the surgery to prevent the aspiration. So here are some nursing diagnoses that we can make for the patient. So ineffective airway clearance, that is related to the increased secretions and secondary to anesthesia, and ineffective cough and pain. After the surgery, patient is having the pain, so this nursing diagnosis we can make. Then ineffective breathing pattern, that is related to the anesthetic and drug effects, and incisional pain. Then next is the acute pain, urinary retention, and risk for infection. Then post-operative management. So we can make the interventions according to the above diagnosis that we have seen yet. Maintain a patent airway. So for that we can put the oxygen mask for the patient. We have to stabilize the patient's vital sign, ensure patient safety, side rails should be raised, provide pain management strategies, then recognize and manage the complications. So whatever nursing diagnosis we had made, accordingly we have to give the nursing care to the patient, or intervention should be done accordingly. Then there is one mnemonic in that four W's comes. So wind, first one is the wind, that is prevent respiratory complications. We have to prevent the patient from respiratory complications. Then wound, so wound should be prevented from any type of infection. Then water, that is the, we should monitor the intake and output of the patient. We can know the kidney functions of the patient if we are properly monitoring the intake output chart. Then walk, that will help the patient to prevent from fluitis. After the surgery, patient should walk as early as possible, because if the patient will remain in one position for a long time, blood will get stagnated, mainly in the lower limbs, and it can cause clots in the patient's blood vessels. So it's very important to mobilize the patient after the surgery. So as the patients transition from post anesthetic care unit to the next phase of care, thorough assessment and proactive interventions set the foundation of healing and well-being. Remember, every patient deserves attentive, compassionate care as they recover. So stay informed, stay proactive, and continue make a difference. Then complications. So there are some complications that can occur to the patient. Respiratory complications, in that the atelectasis, that is the collapsing of the lungs. Pulmonary embolus, any emboli, any bubble, any blood clot that can transfer or mobilize towards the lungs and cause pulmonary embolism. Then in cardiovascular, venous thrombosis can occur. So in venous thrombosis means the blood get clot in the veins. The patient will not move early. Then gastrointestinal complication, in that patient will have the hiccups, nausea, vomiting, abdominal distension, paralytic ileus, that is the iliac muscles or nerves will get paralysis. Patient will not have any feeling and he will not be able to pass the stool, and abdominal distension occurs. Patient can have the stress ulcer. Then genitourinary system, in that patient can have the urinary retention. If the kidney functions are not monitored properly, intake output chart is not monitored properly, it can leads to kidney dysfunction. Then hemorrhage may occur because of the slipping of the sutures. Wound infection may occur if proper care should not be taken. Then wound dehiscence and evisceration. So hyacinth is the separation of the two layers of the skins that we have already sutured, and evisceration means the part of the organs inside the cavity that will protrude outside from that suture line. So dehiscence is the partial and complete separation of the outer layer of the wound, and the possible causes are poor suturing, distension, vomiting, coughing, dehydration, and infection. And evisceration means total separation of the layer and protrusion of the internal organs or viscera through the open wound. So for this treatment is the we have to call for the help. If you will find out any patient, then cover with sterile normal saline soaked gauze and keep the area moist. Do not attempt to reinsert the organ inside. Keep in supine position with knee and hip bent. Assess the vital signs for 5 minutes until medical or any doctor arrives. Then prepare the patient again for the surgery. So this is all about the post-operative nursing care. If you found this video helpful, don't forget to like, share, subscribe to our channel for more nursing education and patient care insights. Let's continue learning and growing together. Thanks for watching. We will see you in the next video.